Good day, everyone. As we all know by now, medical devices are specialized tools or instruments designed for use in healthcare settings to diagnose, treat, monitor, or prevent medical conditions. They encompass a wide range of products from simple devices like thermometers and blood pressure monitors to complex equipment such as MRI machines and surgical robots. And in this video presentation, our group will be introducing two medical devices, namely the nebulizer and the glucometer set. To start, we have the nebulizer. A nebulizer is a medical device that turns liquid medication into a fine mist, which can then be inhaled into the lungs. It typically consists of an air compressor, which provides compressed air, a nebulizer or medicine cup, which converts liquid medication into a mist, plastic tubing, which transfers the mist from the medicine cup to the mouthpiece or mask, and the mask or the mouthpiece, which allows the patient to inhale the medication. Next, we have the glucometer, which is a device used for monitoring blood glucose levels, especially in individuals with diabetes. It consists of the blood glucose meter, which is the device that measures glucose levels, test strips, which hold the blood sample for analysis, a lancing device, along with lancets, which pricks the skin for blood collection to collect a small amount for testing. Moving on, let us discuss the uses/indications of these medical devices. Nebulizers can be used to administer a number of drugs for specific conditions as listed on the table on the screen. The only categorical indications for nebulizer use are when the drug needed is not available in any other form or when the patient is unable to use alternative delivery devices. For example, some children and older patients and in emergency department patients in extremis or people who are very ill and likely to pass. For glucometers monitor the effect of diabetes medications on blood sugar levels, and they work to identify if blood sugar levels are high or low and track progress in reaching overall treatment goals. We have here the indication of glucometer and its contraindication, which includes possible skin infection present at sample site for when the lancets prick the skin po. Next, we have my groupmate who will discuss how to use these devices.
How to use a nebulizer. First, you should wash your hands. Connect the hose to an air compressor. Fill the medicine cup with your medicine. Attach the other end of the hose to the mouthpiece or end medicine cup. Turn the nebulizer machine. Place the mouthpiece or mask in your mouth. Keep your lips firmly around the mouthpiece so that all the medicine goes into your lungs. Breathe through your mouth until all the medicine is used. This will take 5 to 20 minutes depending on the device and the medicine used. If needed, use a nose clip so that you can breathe only through your mouth. Turn off the machine after using and then wash your medicine cup or mouthpiece or mask with water and air dry until your next treatment. Application of nebulizers to a child. Using mask. Put the right amount of medicine in a cup and then connect one end of the tubing to the cup and the other to the nebulizer. Attach the mask to the cup and place it securely over your child's nose and mouth. Turn on the nebulizer and have your child take slow breaths for 10 to 15 minutes. And then turn off the nebulizer after using and then wash and air dry the medicine cup and mask. Whereas in using the mouthpiece, place the correct dose of medicine in the cup, connect one end to the tubing and the other to the nebulizer. Attach the mouthpiece to the cup, and then help and tell your child to place the mouthpiece between their teeth, close their lips around it, and keep their tongue below it. Turn on the nebulizer and have your child take slow breaths through the mouthpiece for 10 to 15 minutes. And then how to use a glucometer. Wash your hands thoroughly with soap and water and then dry it well. Turn on the glucometer. This is usually done by inserting a test strip. The glucometer screen will tell you when it's time to put blood on the strip. Using the lancing device to pierce the side of your finger next to the fingernails. And then squeeze your finger until it has produced a sufficient sized drop and place the drop of blood on the strip. Wait for a few minutes for the glucometer to generate a reading. Track and record your results and then discard the lancet properly.
We will be inserting a short clip on how to properly use a nebulizer and a glucometer set.
With clean hands, take the medicine as prescribed by your healthcare provider and pour it into the medicine cup. Attach the top piece to the medicine cup and then the mouthpiece or mask. Connect the tubing from the compressor to the medicine cup. Put the mask over your face or put the mouthpiece in your mouth between your teeth and close your lips tightly around it. Turn on your compressor. Hold the nebulizer in an upright position to prevent spilling and to ensure the medication is correctly distributed. Take normal, regular breaths in through your mouth so that the medicine can go deep into your lungs. Continue until all of the medicine is gone from the cup.
And then counseling notes for nebulizer use. Ensure proper fit of the mouth or mouthpiece for effective delivery of medication. Replace them if worn or damaged. Use a nebulizer in a quiet and comfortable environment to reduce stress during the treatment. And while using the nebulizer, take or practice slow, deep breath to optimize medication absorption. Consult your healthcare provider for guidance. Have a backup nebulizer or alternative plan in case of technical issues. Additional information for glucometer for counseling of patients. Use a clean, sterile lancet to obtain a small sample, rotating rotate testing site to prevent discomfort. And the use of lancet is advisable, or use your lancet only once, discard if used. And then store test strips in their original container and ensure your hands are dry and when handling them. Regularly check and replace the glucometer's battery as needed to maintain accuracy. And then identify patterns in your glucose reading to understand how your lifestyle affects your blood sugar levels. Eversense E3 continuous glucose monitoring system is a newly proposed device that gives a real-time blood sugar or glucose reading every 5 minutes for people with diabetes. The system consists of an implantable fluorescence based sensor, a transmitter, and a mobile app for displaying the glucose values, trends, and alerts on the patient's compatible devices such as their phones, their tablets, and etc. This approval allows for the new version of the sensor to be worn for up to 180 days. The previous versions of the sensor were approved by the FDA for only 90 days of wear.
Eversense E3 CGM system. This system empowers individuals with diabetes by providing a real-time information about their glucose levels, so let's delve into the key benefits that make it a game changer. With the Eversense E3, users gain real-time insights into their glucose levels. This means no more guesswork, just clear and immediate data to guide their daily decision. This data is a game changer. It allows users to make informed decisions about insulin dosages and carbohydrate intake on a daily basis, putting them in control of their diabetes management. But that's not all. The system also issues alert for potential high or low glucose level, enhancing the user's ability to respond promptly to changing condition. Now, let's talk about the bigger picture. The Eversense E3 collects and tracks long-term glucose trends. This collects data serves as a valuable tool for both patient and healthcare providers. It enables them to collaborate in adjusting treatment plans over time, leading to better management and maintenance of safe blood glucose level. As we conclude our exploration of the dynamic trio, Nebulizer, the Glucometer Set, and the Eversense E3 CGM system, I hope you gain a valuable insights into the comprehensive tools available. Thank you and God bless.